Hope.
Progress.
Inspiration.
Multifaceted.
Impactful.
Amazing.
Motivating.
The word arriving.
Strategic.
Brainstorming.
We gather every year to celebrate the progress that has been achieved and then to come together and reunite and recommit to continue to progress. And I'm extremely pleased that we have already 14 out of the 17 countries and territories who have introduced HPV vaccine as part of the national programs. And this is just one of the examples of the many progress that we have been hearing during this forum this year. At the same time, we do have challenges, so that's why it's important to come today, to come together and join forces to continue to tackle cervical cancer. Cervical cancer is preventable, we know that, and that's why it's important that we focus on eradicating cervical cancer in Eastern Europe and Central Asia, because we know that this is possible.
So I think the most important thing from the conference is really the fact that we've seen such incredible progress across the countries that are part of the Alliance. And for me, it's about seeing the way forward to truly eradicating cervical cancer in the future, and I think truly delivering for the current generation of young people who are now going for HPV vaccines a future where they will not be facing the challenges of cervical cancer in the future. The benefit of the Alliance is that it brings together Ministry of Health colleagues, UNFPA colleagues, colleagues from private sector, who all have this common focus of working towards eradicating cervical cancer. So it's partly the energy that comes with that, but there's also some very extremely important technical sharing amongst colleagues where they're looking at good practices in other countries that then they can take back to their own countries when they return from the meeting.
This alliance provides such a strategic platform for collaborative and compliant policy and medical engagement for us. So the opportunity to engage with government stakeholders, the opportunity to engage with UNFPA as an organization and the regional network is just so valuable. And it's so valuable to do so in a compliant context as a sponsor. What's been built here over the past 3 to 4 to 5 years really provides an opportunity to both engage, to collaborate, to shape, and to learn and to walk alongside these countries as they go against cervical cancer.
So at the World Bank, we see that investing in cervical cancer programs is amongst the smartest economic investments in health.
There is a readiness and need to strengthen inter-country, inter-regional and intersectoral cooperation. This will definitely accelerate the progress in all countries of Eastern Europe and Central Asia. Referring to the discussions and outcomes of the sessions, it is clear that the countries accelerated the progress significantly. There are opportunities to further work and further accelerate this progress, and from regional level, we'll continue our support to the regional alliance, as this alliance is the driving force to deliver transformative results in the region.
All these ideas that are great, really to implement these ideas then into strategies that are feasible for the countries. So it's not always easy, of course, and each country has their own needs and particularities, so you need to look at that for sure. But it's nice to see how these can translate into a path, and so they can become actions, and then so this also impacts the life of people in the end. So there is being a lot of progress again in the countries in a matter of few years. And while you look at that, you see that things are possible. It's just you need a lot of political will, for sure. You need a lot of people that put together expertise, but it's achievable, so that's great.
Every year we feel full to go back to our countries and to start to implement the best practices we learn here.
The achievements of the Alliance countries are a great inspiration for our work. we are impressed by the progress our colleagues have been made in HPV vaccination coverage, the impact of screening on reducing incidence rates of cervical cancer, and how access to service has been organized.
We have introduced from June of this year the HPV vaccination not only for girls but also for boys, and we will start the vaccination hopefully by January of 2026.
The most important thing is the power of coordinated multi-sectoral action for HPV vaccination and screening. By showcasing successful country models and fostering regional solidarity, it reinforced the urgency and achievability of elimination of cervical cancer.
I think the forum inspired me with some, let's say, approach. The first approach is related to involve the school in the process of vaccinations, about the new approach and the new vaccines which are eligible today on the market to be implemented in the country, and the latest information that the specialists have presented to us to improve the vaccination promotion in every country.
Make effort to implement the vaccination in Turkey. I think we would eliminate the cervical cancer. Let's do it together.
What an inspiring forum it has been. It has been wonderful to see all the people coming together, presenting the result, presenting the challenges, presenting the new experiences, innovations that they bring in the country. And I'm particularly inspired when I see people speaking to each other and really making it a personal commitment and creating the network that we need in order to be able to continue to advance. And every single person has been engaged over those days here in Skopje. I'm leaving Skopje with the strong belief and trust that every person will continue to do their best so that we can eradicate cervical cancer in the region, and that's why we have all been here. So extremely happy with the forum. Thank you to everybody.